Hi, Stephanie. Welcome to our conference on trust, racism, and healthcare. Stephanie is a nurse who's spent 40 years working brilliantly, last 15 years or so, in hospice care in North Carolina. She's a mother, grandmother, three wonderful grandchildren. She's a de novo metastatic breast cancer patient. Tell us, what are the hard questions that you, as a Black woman newly diagnosed in 2015, were facing vis-a-vis being a Black woman newly diagnosed with de novo metastatic breast cancer?
Being diagnosed straightly de novo metastatic breast cancer as a nurse, I knew nothing about metastatic breast cancer. I had those patients in hospice care. I knew they lasted a little bit, then they died. I knew about cancer in general, but my own diagnosis, I didn't know much. And I truly, honest to God, didn't go Google much about it. I, had issues early on with the diagnosis with a healthcare provider, but I let it go and just thought that, that's just, you have good doctors, you have bad doctors, you have good decisions, you have bad decisions, and, you just roll with them. But I really didn't know much about the community. I didn't know much about what I needed to know, what I needed to ask for. I just went along with the program.
Did you, at that time, do you recall if being a Black woman sort of made you wonder, are you going to get the same care as everyone else?
Getting care that I needed was top priority. Not knowing what I needed, I depended on my healthcare team to tell me that. And I never thought race would play a part into it. And I jokingly say it's almost like, working in the pediatric intensive care unit, and we had, open heart babies, and you could always tell which babies would do better or those that wouldn't fare as well. And it was like, the Black female open heart baby would do great. They would just, I mean, kick ass. They do great. Next came along the white female, then the Black male, and then it was, last bringing up the rear was the white male. We always called him the wimpy white boy because he struggled all the time. So, I didn't know, as far as race, if it would be an issue. It wasn't until much later that I realized that it is an issue when it, came to my doorstep. So
And how is it an issue?
it's an issue because it's the implicit, explicit, institutionalized biases that our healthcare system has. I don't, I want to believe that unfortunately we make people racist. They're not born that way. And I seen evidence of that. We're not born that way. It's that what we're taught. And as we grow older, we have our own ideas. We see things in our surroundings that actually help form us. And so in med school, when you hit med school, I don't know what the hell happens. I think it all goes out the door and you just believe whatever you're told or whatever you read. And some of those are not true, like Black people don't feel pain, I let me come over here and let me squeeze your balls and let me tell you if you feel pain, whether you're black, white, red, green, you know what I mean? It's that kind of teachings that once you hit med school, I don't know where that division comes in, where as a child I had a lot of Black friends and we played and we didn't recognize race as an issue. And then when I hit med school, I'm the white superior person and everybody that's not like me is below me. And I keep telling people all the time, invite me to your school so I can teach you about racism and how to have a conversation with me being Black woman. Because when you come to see me in your exam room, you forget all that. You look at me and you think, okay, here's a Black woman. She's not going to know, and I'm going to use clinical trials because that's what I love to talk about. You know, clinical trials, she's not going to know what a clinical trial is, Or if she does, she's not going to complete it because they never complete anything that they start. And then if we really piss her off, she'll become that angry black woman. And probably I would. So with that, those biases stacked against me before you say, hi, my name is. You've already got these decisions already made in your head. You don't know who I am, but you've already made those decisions for me. And I just want, I wish there were culturally sensitive classes that are just as important as an anatomy class in med school, but obviously they're not.
Right. What can you recall any specific things or feelings that you had when faced with a doctor who wasn't black?
I've had very few black physicians in my whole lifetime, whether it was dealing with metastatic breast cancer or not. But I had a physician of another from another culture, not black, not white, dealing with a pain issue during COVID. He kept insisting that I wasn't having pain because my scans, quote unquote, were normal. My blood work was quote unquote normal. So I could not be having the pain that I was describing to him. And as a matter of fact, he left me a voicemail on my phone that I think it's in your head. You need to see somebody about that.
Hmm.
Unbeknownst to him, I was already seeing somebody about those head issues. So he didn't know who I was. He had no idea who I was. So, to refer to, you know, I I couldn't possibly be having that issue. And I found out as I was talking to other metastatic patients that see this physician and had been seeing this physician longer than me, said that, oh, yeah, he's always like that. He hardly ever gives us pain medicine when we ask, or he never addresses our concerns as real. So, but why is it? Why is it that it's just black people? Have y'all not thought about going to get another provider? And it's no, I can't. I live in this community. He's all I have.
Right. Well, how does that make you feel vis-a-vis trust uh, in doctors in general?
That probably leads to the big issue of the mistrust in the African American, the Black communities. We, as a whole, have always had those mistrust issues of the healthcare providers. Deep, I say deep mistrust. We will always, the majority of Black people go to a physician, they trust their physician enough to go back again and to listen to what they say, but do they understand what they're being told? So, we will trust you as far as my mom would say, I trust you as far as I can throw you.
Okay. I'll keep that in mind if ever you're sitting in my office. That the idea of black patients returning to their doctors, the same doctors that they distrust, that they feel unheard and unseen. One listening to our conversation at this moment might say, well, isn't that the fault of the patient for returning to that doctor? Why didn't the patient find a better doctor or a different doctor? What do you say to that?
Partially it is our fault. I'd say our responsibility. I think it's the healthcare system that man has created is also at fault. And also where you live kind of like tells you where you can and cannot get treatment that people believe in. So, if you live in a rural community, you have a community hospital, you think that that hospital is it. That's all you know. And if you don't have other means like means of transportation or financial needs to seek outside that box, you're not going to. If you don't, our culture believes in, sticking close, it is, if that's what I was raised to say, Dr. X, Y, and Z, seeing my mom and my grandmom, so that's who I'm going to go to because they're still living and he treated them well. But who's to say that that treatment was just what he's used to and not what you really need?
Hmm.
So we rarely make people put their feet to the fire when it comes to healthcare.
Right. And the influence of geography, of being rooted in a community, being rooted in a community where racism, Jim Crow laws still resonate. It's not like you could just lift your house like in The Wizard of Oz and hope the tornado takes you to a nicer
Exactly,
place. Yeah.
exactly. You can't. So, it's like we have to start building a stronger community where there's a friend of mine that has a nonprofit that she always said, where we live, play, work, and slay. So, we need to start taking our own health serious and realize that, if we don't advocate for ourselves, nobody else is going to do it.
Sure. We've talked about racism in the doctor's office just now. What about racism and without using like institutional phrases, what about racism in the hospital setting?
You're treated with, just the surface pleasantries usually. I work for this institution, so they're coming here, so I got to be nice. So it's just kind of like just the surface stuff. Is it genuine? A lot of the times it isn't. They want to say that it is. I have, as a nurse, just as a nurse, being a black nurse sometimes in the specialty in which I worked many years ago, before the early, before 2000 even, working in a pediatric intensive care, there weren't very many black nurses at all. So there was instances where, oh, you can't take care of my child, you're black, you know, or you can't do that. My child may cry because they've never seen a black person. Or, working in the ER, I'll never forget this old gentleman. Discharged this old gentleman, was getting ready to put him in the wheelchair. And as I'm bending over, lifting the footrest, he rubs my back and says, I bet you're glad you're not out there picking cotton. And then he was made to allow to wheel himself out that room because I turned around and told the nurses, like, I'm done with him. He's yours.
Yeah. We've heard many times that black patients prefer white doctors to black doctors, as if like the white doctor will know more than the black doctor. Talk a bit about that, please.
you know, I I never realized that until much older, that some black people were that way. I've been mistaken for people that work in dietary, not that that's a bad thing, or housekeeping, not that that's a bad thing. As I stand there with a name tag that says RN on it, it's just, I guess that's just a norm. I don't know why is it the norm that we can't be educated, we can't hold higher positions in, healthcare or any other thing. Yay for those doctors that are out there, and go President Obama. But with that being said, we do the tendency to see that, and we see it. I see it more in the older generations, the older populations, those black people that are 70, 80, 90 years old, that kind of like are a little hesitant, when I walk in a room and say, hey, I'm the RN, and it's like, yeesh, and then somebody else comes in and they're more friendly than, to them than me, because, she's white and I'm black. But, that's par for the course. I don't know why that is, but the younger generations need to start opening up and talking about healthcare issues to mom, grandmom, great grandmom, to let them know that, you need to, things need to change. And nurses, I have got to applaud. I'm not going to say they don't see race, but they take care of all their patients, it seems like, equally. It was, they want, you want them out of your space, you know what I mean? So they're all treated, and the most nurses I've worked with, and I've worked with them East Coast, West Coast, and everywhere in between, as a travel nurse, I've seen nurses that are very caring and giving. That was back then. I'm not going to say in the past 10 years things have changed, but they did not see that difference, or they didn't want to address that difference. They took care of the patient as the patient. But when these patients got older, it seems like that the tolerance for black men and women, um, was treated a little bit different, because it seems like the older we get, and maybe that's my problem now, I get a little bit more mouthier and I don't care if it hurts your feelings or not. It's the truth. So, maybe that's where those people were in their lives, of speaking the truth, or they've already always been mistreated and now they're standing up for themselves and people think they're being defiant or non-compliant with care. But I don't think that's the root of it all. I just think that we, as healthcare providers, sometimes are intolerant of you know change. We don't like things that are different than from our different norms, and
Sure.
that's probably what it is.
Mm. Let's leave the hospital and the doctor's office for a moment. Let's look at the outside world, pharmacies, the opportunity to read about things, how pharmaceutical companies publicize and market their materials. What are your thoughts on that?
Why are there so many cigarette ads and alcohol ads and uh, check cashing places? Why are those always in Black communities? Why is it such a prevalence there?
So
Um,
what's the pharmaceutical company
exactly,
equivalent of that?
pharmaceutical companies. I can say, and I'm going to hurt a lot of my friends' feelings that look, we're in pharma, but here's the truth: there are medications that pharma manufacturers, distributes, labels that target a disease process. And if that disease process is seen predominantly in African American, it's portrayed as such as African American. They make those commercials. Did you know that the United States is the only country that allows pharma commercials on TV? But anyway, so with that being said, they target different audiences. Medications are marketed differently to different audiences. Like, it seems like all the diabetic commercials that I see now on TV, there's a lot of Black people in them. The white people get diabetes too. And when you're talking about prostate cancer, that's another one. I A lot of the ads that I see in doctors' offices and everything are Black men with prostate cancer. And I think letting people know that that happens to Black people is great, but it seems like you're targeting just Black men, whether it's good or bad or ugly. And I just wish that I would wish it was equally access to these drugs. When you're talking about pharma, I wish we all could afford them. They sometimes get out of range where people can't afford them, and those people that can't afford them are usually people that are Black, brown, other nationalities, other races. Being Black, we are the ones that pharma, it's an easy target, because if there's a pill out there that's and it's a disease process that we have, they're going to market that for us, and we're going to talk to our doctors about getting that specific treatment, which is an easy target. Take a pill for it. 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 And and these medications that we are taking, that we haven't been part of the clinical trial. Who's to say they're even going to work for us?
Hmm.
You know, so less than 6% of all cancer patients are Black in clinical trials. Who's to say? Hell, there was an FDA approved blood pressure medicine out there that we were taking, like, with Black people were taking left and right. We found out, guess what? It's not effective on us. So you don't order it. So it's I don't know, a double-edged sword, as they say. We are targeted, but then we're not given the best. We'll take that pill because you can't have this treatment because you can't afford it, or it's going to be too expensive, so we'll just suggest that you do active monitoring your prostate disease. And men take that as an easy way out, and you come back later and you have more aggressive cancer, and then they want to think it's all your damn fault because you didn't do anything about it in the first place.
Right.
If you're not given all the information to make an informed decision, how do you make an informed decision?
So your husband has prostate cancer. Do you think that black men are being offered active surveillance more frequently than white men?
I can't really speak on that. I really don't know. My husband, who is a lot older than me, chose to do active surveillance with his diagnosis in 2022. I was blown away, truly blown away. I knew something was amiss with him, but men don't listen. So after making him go to the doctor, he gets his diagnosis, and then he decided he is also a head and neck cancer survivor from early 2000s. He
Mhm.
said, "I'm not going through that again." So he chose to do active surveillance. Then you go fast forward, a year later, where he goes back, monitoring time, gets more biopsies, more aggressive, and has spread more. Well,
Yeah.
then it's like, now what are we going to do? You know? And then he decides he wants to do treatment. And when it goes the route of radiation, he had a physician that was not white, not black, treated him like shit. Absolutely horrible treatment. And I couldn't when I would say something, he would be defensive. So I stayed out of it until my husband had lost 15 pounds in 4 weeks and wasn't eating. And then he looked at me and said, "I need to unleash the bulldog on my doctor. I can't do it anymore." And he was being dismissed. Every symptom he had. And I thought to myself, and this is where I thought, if my husband, an educated white man, was being dismissed, oh my God, the black patients going there are screwed. I didn't I don't understand. And I had to get this man on the phone and ask him what the problem was. What did he, I mean, come on. Well, it must be something he's eating that he's losing this weight and having to go to the bathroom all the time. No, sir, he's not eating. And he says, "Well, I don't know." I said, "I'll tell you, I give everybody choices. When I'm yelling at you and I'm mad at you, I will give you a choice." And I gave him a choice. You either talk to my husband and rectify the problem at his 2 o'clock appointment today, or I'll see you on Monday and it won't be pretty.
Yeah.
So the choice is yours.
Yeah.
So that's what I'm saying. Age, is discriminated against as well. I just could not. I mean, my heart went out to sitting there sometimes in the lobby, very infrequently going with him, to see all these black men go see this one doctor. And I just could not imagine what the conversations were like if he was treating my husband that way.
Yeah. What are the questions? What are the things that patients of color should say to their doctors, and how they might vary those questions, if they should vary those questions, for white doctors versus doctors of color, or doctors that resonate with, that have a racial concordance with them, but specific around having good consultations. In other words, like, doctor, I want to feel comfortable with you. One way you could do that is by assuring me that you'll listen to whatever I have to say.
And, I was going to say that, be direct. Don't dance around the subject. Say, if I have an issue, are you going to be able to listen to me? Are you going to hear what I say? If you are going to talk over me or dismiss me, then maybe, we're not paired for each other. Maybe we're not right for each other. I've learned, it wasn't in the beginning, I have learned to say, "Do you have any patients that look like me? How do you treat them? You're treating metastatic breast cancer patients. Do you have any black ones? Have they lived a long time? Or are you killing them off early?" I'm just asking, because that's going to depend whether I stay with you or not. I had that instance with this oncologist that I'm going to see today initially. She walks in the room and says to me, "Hi, my name is, why are you on this treatment still?" And I tell you, red flags were throwing like I was a stripper on a pole, like, oh, she's not for me. No, she's not for me. She's trying to kill me off already, and I don't even know her. So, you need to have open communication. You need to be able to say, if I have a problem, who do I contact? Are they going to get back to me before a week? I'm just asking, is it going to be quickly? Don't make me wait 3 or 4 days when I'm over here hemorrhaging or, common sense stuff, Um, I have learned to say, do not ask this question. It, give me the best treatment. If I were your mother, what would you do? Because he may not like his mother. I have learned not to say that to anybody. Or treat me like your sister. Maybe he had a sister that used to beat his ass all the time. I don't know. So I don't even do that reference of family thing anymore because you don't know what the relationships are with those other people. So, I want the best treatment. I want what is the standard of care and better. And if possible, show me what the standard of care is for my treatment. Show me my treatment plan. What is your plan for me? Because here's my plan for me. You need to say, this is what I want. This is what the outcome I want to see. And be specific. And we all, whether it's to live long life or to have a better quality of life until that time comes, we all have differences. We all come from different backgrounds. Your doctor needs to know who you are outside of that 15 minutes that he spends with you,
Yeah.
because he doesn't know if you go home to you're the primary caregiver and you can't be in a clinical trial, or if you take care of multi generations in your one family and you're the only person that works. He doesn't know if you go home and you're taking care of special need children. He doesn't know if you go home to a home. You may be homeless or living in a shelter or living in a tent under a bridge. That's what a social worker told me. Yeah, I can help you only if you lived in a tent under the bridge. So, those things, your doctor needs to know who you are. And if my doctor takes time to know what's important to me, then that doctor's a winner.
Yeah. Sort of, I'll listen to you if you listen to me. Stephanie, thank you very much for today's conversation.
I hope it helps somebody, anything.
Well, if it's helping somebody watching this, raise your hand, you know? Thank you.